And welcome to the Vacsax Advanced Liner Medical Devices training. By the end of this training, objectives are that the user will be able to use the liner appropriate for its intended use, demonstrate to check for damage, wear and faults, understand the limitations and contraindications of the liner and canister, be aware of the relevant accessories available, be able to demonstrate how to safely set up the liner, be able to demonstrate how to check that the liner is working correctly, be able to demonstrate how to dispose of the used liner and associated accessories, be able to demonstrate and clean and decontaminate the Vacsax liner, and understand the actions to take if there's an error or failure of the device. Suction canisters are rigid canisters for use with appropriately sized Vacsax Bacti-Clear antimicrobial disposable suction liners, designed to minimize the risk of cross-infection. The suction canister and liner provides a temporary storage container for secretions or fluids removed from the body. These fluids or secretions may come from the patient's lungs, stomach, or wounds. The suction canister may be seen attached to the walls on a bracket or on a mobile stand in areas such as theatres. On the canister there are increment measuring scale, a wall bracket slot, and on the Vacsax liner there is a patient port, vacuum port, stopper for patient port, and graduations for measuring the content. Right. So check for any obvious signs of physical damage to the Vacsax canister and liner. Check that the lid of the canister is properly sealed by completing the following process. Turn on the vacuum to maximum and place your finger over the patient port located on the lid of the liner, ensuring that a vacuum is present. Vacuum will build up when all parts are assembled correctly. Please note that if the liner is set up prior to use and not in use, ensure that the vacuum is turned off. And if the liner is set up prior to use, turn the suction controller to the desired level. Limitations and contraindications. The device should only be used by staff who have been trained and assessed as competent as per the NUH Medical Devices training policy. Ensure that visual and functional checks are performed before use. The device is limited by the canister volume and liner volume, and staff should ensure that the correct size liner is used in the canister. How to be sure relevant parts and accessories are available. The non-disposable parts are the canister holder, and the yellow tubing, taper and T-piece if it is in use. It's dependent upon canister size and or area. Please note that the tubing kits do not require changing between patients, as they are protected from internal contamination by the filter within the suction liner. Any external contamination may be removed with disinfectants. Should the tubing kit become obviously internally contaminated, it should be replaced. The tubing kits have a 7-year life and should only need replacing if damaged or internally contaminated. Then on to the disposable parts. The Vacsax liner Bacti-Clear suction liner, 1 litre, 2 litre and 3 litre, depending on canister size, and the patient suction tubing and yanker/suction catheters. The disposable parts must be replaced after each use. For infection control purposes, the suction tubing should remain in its sterile packaging until required. And note that the device is limited by the canister volume and liner volume. Ensure that the correct liner is used within the canister. If it is not, you can still use it, just be aware that you're going to have a much smaller capacity than expected. So how to set up the Vacsax liner. Check the liners within its use date. This can be found on the printed on the liner and on the packaging label. Ensure that the rigid canister is clean and damage free. Remove the liner from the packaging. The liner is folded for storage. Do not leave the liner folded in the canister. Place the liner into the rigid canister and push firmly with the patient port facing forward for ease of connection. And push the tapered connector onto the vacuum tubing from the suction controller into the vacuum port with a twisting motion. Turn on the vacuum to a maximum and place your finger over the patient port located on the lid of the liner, ensuring a vacuum is present. Vacuum will build up when all parts are assembled correctly. Connect the patient tubing firmly to the patient port to ensure a good fit. Regarding 3 litre canisters and liners, I won't go into that as you will not find them in our area. However, if you do want to know more about them, then please ask your local medical devices trainer. But always check that the Vacsax liner is working. Conduct a pre-use check, turn on the vacuum to maximum and place your finger over the patient port located on the lid of the liner, ensuring a vacuum is present. Vacuum will build up when all parts are assembled correctly. Confirm that the suction is present at the patient tube by manually occluding the patient suction tube before proceeding. So, disposing of the used Vacsax advanced liners and associated accessories. The liners should be removed when 3/4 full or sooner if no longer in use. Ensure that appropriate PPE is in use. Using the handles on the side of the liner, remove the liner from the canister. If the canister liner has been used, do not remove the patient suction tubing from the liner lid, leave intact, and dispose of the liner tubing and yanker or suction catheter according to waste management policy. Do not leave a used or contaminated liner in place, and do not attempt to reuse your liners, they are single use. Do not leave a vacuum on when not in use either. Cleaning the device, follow NUH policy, green Clinell wipes on a regular basis to clean just the external surfaces, or red Clinell wipes when clinically indicated. Ensure obvious signs of dirt and contamination are removed. Actions to take if there's an error or failure device: remove the device from use after ensuring the patient is safe and unharmed. Complete a clinical engineering decontamination form detailing errors, codes or messages. If the device is involved in an incident, ensure Datex number is recorded on the decontamination form, and then ideally return the device to clinical engineering as it was set up and used. If this is not possible, take an image of the set and ensure this is uploaded to the Datex incident form. I would probably just take a photo and then dispose. And that concludes your preliminary training for the Vacsax advanced line for medical devices. Now, if you go to your medical device trainer for a practical assessment.